Assalamu alaikum, everyone. Welcome to another monthly frame session. Thank you all for joining us this evening. Before we get started, we have a few announcements. Alhamdulillah, ALIM was a recipient of the Hibri Foundation Award. ALIM is honored to be awarded a $25,000 grant and to be recognized as a national nonprofit training current and future leaders of America. The award funded new initiatives this past year, including ALIM's expanded curriculum and leadership programs. And the ALIM Summer Program, our flagship program, is going to be held this summer at Benedictine University. And the spots are filling up soon, so go to alimprogram.com/summer program to register for our program. It's truly a life-changing experience as someone who attended the ALIM Summer Program in 2019. It's truly a beneficial program for American Muslims of all ages and backgrounds. So definitely take the opportunity to register and inshallah attend the summer program this year. A few quick facts about ALIM. We have expanded the ALIM team to fulfill our programming. There are monthly blogs and virtual live events hosted by Ustadh Ubaydullah Evans with various community leaders. And last summer, the 22nd annual ALIM Summer Program was successfully held in person after a year of the COVID pandemic pushing it virtually. We were able to hold it in person last summer. And we have introduced a hybrid spring program on aspects of the Prophet ﷺ, as well as a virtual winter series on the life of Malcolm X and lessons from his legacy. So inshallah, continue to support ALIM so that we can continue to expand our programming and benefit the American Muslim community. So tonight, our frame discussion is on mental health and maintaining healthy relationships. Our discussion will be with Ustadh Ubaydullah Evans hosting Dr. Heather Laird. And I'll give you a bio of Dr. Heather Laird in just a moment. Dr. Laird holds a Doctor of Psychology with a specialization in marriage and family therapy, a master's in clinical psychology with a specialization in marriage and family therapy, and a master's in public administration and nonprofit management. Inshallah, Ustadh Ubaydullah Evans will be hosting Dr. Heather Laird in a discussion on the importance of mental health in maintaining healthy relationships.
Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
How are you?
Alhamdulillah, how are you?
Alhamdulillah, ala kulli hal. We praise Allah in all situations. How's the family?
Alhamdulillah, everybody is, alhamdulillah, good.
Good.
It's a long time since we've seen you.
I know it's been, I think I was out for Thanksgiving like 2 or 3 years ago, right?
Yeah.
MashaAllah.
It's good last time I was out of the house.
It's good to see that you're keeping well, MashaAllah.
Alhamdulillah.
Alhamdulillah. And how has your work been?
My work has been really busy. Yeah.
I'd imagine so. I think one of the, depending upon how you look at it, positive consequences of the pandemic is I think all of us have been checking in terms of our mental health, or perhaps realizing the very fragile basis of a lot of our wellness, and when some of our routine and some things we rely upon for normativity, regularity are taken from us, some of us can really struggle. Many of us struggle.
No, absolutely. And when COVID hit here in California, the governor asked all therapists to step up and take on more patients. And so, I like many did. And for 2 years, we've been working very solidly with very large caseloads. And I'm looking forward. Next week, I plan to take the week off. It'll be the first week I've had off in 2 years. So,
Subhanallah, subhanallah.
looking forward to.
And I mean, what is it about? I mean, I think all of us kind of know anecdotally, but what have you been seeing in terms of what are some of the real challenges to mental health in this time?
To be honest with you, I think it's probably similar in every time. We just package it a little bit differently. And if I'm going to leave the Islamic scholar piece to you and my husband and all those who are trained. But as a lay Muslim, if we think about, Adam and Eve and the creation of one to be a comfort to the other, it's about connection, right? And that attachment is just as primal, I think, as some of our basic hierarchy needs, food, water, shelter, and so forth. And so we can take that all the way back to the beginning of being. But to the extent to which we are securely attached to one another healthily, that will lead to more or less symptoms of dysfunction and malady. And so I think that's constant throughout our history. And of course, it takes a different. It looks differently depending on what part of history we're part of.
Yeah. That's one of the one of the few authentically universals is relationships. I don't care who you are. I don't care how lofty your spiritual ambition or aspiration, or how lowly. Relationships are a constant and consistent source of growth, of struggle, of enjoyment, and of anguish at times, I think, in our experience as human beings.
And not to hit you with something deep out the gate, but if we think about our spirituality, if it's absent and we are alone, we are really isolated, right? When we have spiritual connection, even if we have no ability to be around other human beings, at least we have an attachment. We have a healthy attachment. If we are without that altogether, isolation is one of the first things that will move people into a very distressed state. And it can be quite traumatizing.
Yes.
Depending again on what you have to turn to, even if you are the only person in the room. So if you have Allah to turn to, that can make all the difference in the world.
Yeah, I mean, it's interesting. In a lot of the, I guess you can call it a spiritual regime or a spiritual diet. Often khalwa or solitude is a recommended practice. Right. It's a recommended practice to spend some time in solitude. But I think those recommended practices rely on the idea that normally we're in relationships. We're normally deeply enmeshed and ensconced in familial relationships, communal relationships, professional relationships, so that taking some very intentional solitude becomes a spiritual practice. But I think in COVID, some of that solitude has been like imposed on us. It's not something we're engaging intentionally with the goal of kind of opening certain spiritual windows and vistas, but the imposition of solitude is what I think a lot of us have been wrestling with.
Exactly. And so, like, if you, depending on how you have been with your attachment throughout your life, this could send people right into crises. or for those who have a secure attachment, which we can talk about a little bit. I mean, secure attachment looks like I have a positive sense of self. I can ask in a coherent way. I can ask for what I need. I can caretake. I can also I can give and take of care. And if that's in place, right, and I feel secure while attached, right? I mean, there is what we call effective dependence. You can actually depend on others and that not be, because there's been in pop culture in the last few decades, there's been a real focus on what we call codependency, where like the person that you're with finishes your sentences before you finish them. Now, inevitably, when you're with a person for a long period of time, you are going to, become more alike than different, hopefully. But I'm not talking about really codependency. I'm talking about effective dependence where I feel secure and autonomous at the same time, right? I feel like I'm that it's like what we think of when we think of a Muslim marriage, right? Where two individuals come together to remain two individuals, not a Christian unity candle ceremony where two individuals come together to be one, right?
Right. Yeah, of course. It's very, very important.
And which is not to disparage others' practices, but rather just ours are different. And so that it's a more secure attachment in theory.
Yeah, no, I've been asked to perform or officiate. Although the term officiant always strikes me as, I don't know, if someone said you want to officiate the wedding, I always feel like I should be wearing like a striped shirt with a whistle and right when you officiate. But I've been asked to officiate many weddings, and I always cite that line from Khalil Gibran that, stand close but not too close. For the pillars of a mighty temple stand apart from one another, and the cypress and the oak grow not in each other's shadow. Right? So a very poetic and very beautiful way of saying that, marriage should make us close, but we will remain distinct individuals. And I think that there are many stories in the Quran that indicate in very stark terms that individuality that is retained in marriage. Fir'aun is one of the enemies of God, but Asiyah, his wife, is one of the beloved friends of God, and they're married to one another.
Yeah.
Right. So sometimes, I think, that we retain our individuality in marriage. I think that's very important. But I think it's not just retaining our individuality in marriage, but in all of our relationships. Right?
Sure. Because, what I like to tell couples is that, when you're looking for someone to marry, you're only going to find at max 80% of what you're looking for. If you are over 50%, that's a good mate. So somewhere between 50 and 80, you've got a great mate there, right? But there's always going to be at least 20% of what you're looking for that's not included in your marriage. And so the question becomes, okay, how do you healthily, deal with that 20%? Is it through friendship? Is it through family? In a halal way, right? So how do you do that? And this is a question oftentimes couples don't ask one another or even discuss before marriage. How will we deal with those pieces that we just don't give each other, which is normal, very normal and natural. Is it going to be through community? Is it going to be through friends? Is it going to be through family? Or something else, but in a halal way? How will we deal with that?
Yeah, I try to convince my wife that anything that I don't get through the marriage, I should probably seek it through sports cars, but she's not convinced by that. No, I'm just being facetious. No, I'm actually not. but one thing that I wanted to talk to you about is mental health awareness is becoming increasingly popular in our society. In fact, sometimes I worry that non-specialists like myself, right? I'm very much a layperson when it comes to mental health, knowledge, that we're deploying terms that should be used by professionals with training too readily, too flippantly, too irresponsibly. So people they have a problem with someone and they just say, "Oh yeah, she's a narcissist." How can you? Wait. Oh yeah, he's a sociopath. My boss is a sociopath. That person, has narcissistic personality disorder. I'm like, can you just say that? Does it require someone that has clinical training and skill to deploy such terms? Or, am I being oversensitive here? Or
no, I don't think you're being oversensitive at all. And I'll rip this veil off, and but I'm not going to rip all of them off. I might scare people. In truth, personality is if we think of sort of a circle of characteristics, we all have a little bit of all of them. Mm-hmm. So every single person in this universe has a little bit of narcissism. Otherwise, you would not take care of self. So, there's a little bit of that in everybody. And so, before we start pointing fingers at everybody and calling them narcissists, we have to check ourselves. And, yes, people should refrain, really honestly, because even practitioners, right? And this has actually become more and more of a discussion. One might even go to the boundaries of saying it's controversial in a way, right? As we look at the diagnostic manual, who's making the judgment of what these diagnoses are is relevant, it's important. And most clinicians that I know who have been clinicians for some time don't really like diagnosing people as much as people might think, because labeling people is not particularly helpful. In fact, what can happen when you label a person is that they can live up to the label because you gave it to them. And we want to certainly avoid that. We would rather like to see diagnosing people as a means to treatment, right? If we have this certain cluster of symptoms, how do we know that, through research and testing, different methods, how would we know to treat that? And we that's the importance of being able to diagnose and look at those cluster of symptoms. It's not for the purposes of demonizing and stigmatizing. And, so if somebody has a narcissistic personality disorder, one of the first questions you want to ask, right, is what happened to them? Because people don't arrive at narcissism usually from good means, right? A narcissist is evolved out of usually some very traumatic means, which usually includes really a very unhealthy attachment, or maybe no attachment from the time they were, a baby.
Wow. Yeah, and that's the thing too. I think, as I listen to you, it's strikingly reminiscent of listening to a lot of the specialists that I know, like in Islamic law. They're very reluctant to say something is categorically forbidden. Rather, there's a much gentler touch. There's a much, it's like, well, let's see how we can kind of understand this, placing upon it the most generous construction possible. And then where there's no alternative, then we're forced to say this or that. But of course, people that don't have that specialization, everything is haram, this is haram, that's haram, this is haram, this is haram. And it sounds very similar. I hear a parallel that people that are real practitioners, people that are clinicians, rather than just labeling somebody a narcissist, or labeling someone a psychopath, or labeling someone a sociopath. There's a much more nuanced process of trying to help people seek mental wellness. But when that process is, in a sense, vulgarized almost, right, in kind of popular discourse and vernacular, it becomes these pejorative terms. This person is a this person is a that. And if I'm being honest, a part of me as a religious thinker, I've always recoiled a bit, because it just sounded so totalizing. When I would hear people deploy that language, until I started meeting more Muslim practitioners, it almost sounded like a different worldview entirely. Like it almost seemed quasi-religious to me. Like, wait, it just, I don't know, like something in it, like something in it seemed to suggest to my ear that I was listening to like Aqidah or something, like what? It just, I don't, it was strange to me. It was really, really strange to me, and it was a bit off-putting. But alhamdulillah, many Muslim practitioners and other practitioners of other faiths have talked about holistic wellness, including the mental, including the spiritual, including the physical, the religious, all of those kind of working together. As a Muslim of conscience and practice, how is your mental health practice kind of integrated with your religiousness, so as to speak?
Well, it's interesting that you asked that question, because as we were talking, I was thinking about one of the things that in my practice that guides me is just remembering the prophetic way of meeting people where they are. So when people would come to our prophet, peace and blessings be upon him, they would say, or he would address their individual needs, or he wouldn't make sometimes he would make a broad application. But like for the most part, when people would come to him personally, he would address that person's needs in front of him. And that's kind of, well, it's not kind of, it is what we do as clinicians, right? We see that, we try to see and hear and be present with the person in front of us and look at what that person's collective, patterns and social locations and layers of the system that we are a part of have affected, which ways it's affected them and help them individually. Because everybody has their own unique experience. And we hold space for them. And a lot of times, right, and a lot of what has happened over COVID period of time is that people have come to realize that. So there are people like John Bowlby, for example, looked at the parent-child relationship and spent his whole career and life researching that. And there wasn't a lot of work done on adult attachment until after his passing, or right around his passing. And there's been now more of a focus on adult attachment. But when the parent-child relationship is not a secure one, when that doesn't happen, oftentimes people will feel that they've never been seen or heard. And that puts people in a very a state where they don't have necessarily self-positive regard, of themselves. They don't have secure attachment. And so by offering a holding space where they can feel that motherly or fatherly experience that was absent, that part of themselves can heal, and they can once again, or not once again, but rather establish that security that may not have been there. It takes about 2 years of that holding that space for a person for that to fully happen. But it can happen. The healing can happen.
That's really I mean, that's really profound. You know, one of the things that I think about often is that sometimes when we talk about mental health, a lot of what I've seen now, of course I don't know the full extent of what is available, or in terms of methodologies or practices, but it seems that people often backtrack, or they often recollect certain aspects of their past, and they're trying to find some moment or some formative period or some event that traumatized them, that caused them pain. And then it appears to me that that often the approach that is taken is kind of like that that pain unresolved, that pain not effectively dealt with, then unhealthily affects our behavior as we mature, develop, progress, move forward.
So it certainly can, but it also, again, okay, so there's a couple different answers to what you're asking here. One is it certainly can, but I know that when you have undealt with traumas or experiences that are really significantly negative, it can take up residence in your body, right? That is true. But I also want to leave that space a little bit more open, because I've talked to people in certain social locations who, by the necessity of the social location that they are in, they keep stepping, right? Like they don't, it's not, they don't view it that way. And so, like, I think that it's a mistake to sort of have a one size fits all, and we don't in theory either.
Right.
So
Okay.
in theory, we have what we call modern and postmodern theories. And in the modern theories, it is about looking at the past. And so a lot of the treatment will be about going into the past and rectifying the past. Postmodern theory suggests something else, that we don't have to go in the past. We may visit it for a brief moment, but we will keep moving forward in the present. And so,
yes.
And with a lot of, so a lot of the modern theories did not, the theorist passed away, let's say, before their theories added on components of sociocultural attunement. And the postmodern theories are all about sociocultural attunement. So the postmodern theories have become, there's a little bit of popularity with them right now because of they are their whole existence. So, for example, like feminist therapy, is focused on gender, patriarchy and so forth, right? And so, and each theory that's in the postmodern theories has some relevancy to social justice in some way. So, however, that's not to say that the modern theories don't have their legitimacy or worthiness, right? In fact, I have found, one of the modern theories to be very in line with our values and beliefs as Muslims in terms of the significance of family. So, like modern theory, we look at family and the family dynamics, and that's very relevant to communities that value family. So there's a couple different ways you can go in terms of the actual therapy, and most therapists know one or two theories very well, or they're encouraged to know one or two very well. It is rare that Assalamu alaikum. How are you.
Assalamualaikum.
MashaAllah. You've grown so much. MashaAllah.
She just totally commandeered this session because she wanted me to see her hair. It's very nice.
Yes, it's beautiful. MashaAllah.
Okay. Makita, can you close the door then? Thank you, Ben. Yes. So for communities that value family, of course, going into the past and rectifying maybe some of our issue with family will be very important. But I'm really interested in also these postmodern theories because sometimes I find those to be very aligned with our kind of religious ideals, in that mental health and positive behavior can be incentivized by, what's in front of you, even if you don't go back and rectify what's behind you.
And that's true, right? If what's behind you is horrifying, it might be easier just to go forward, right? I mean, so this is where that unique individual piece comes into play. Having said that, also in the postmodern theories, one of the things that one of the more recent theories of what we call collaborative theory focuses a lot on language and language meaning. Also narrative therapy. And so these therapies are really interesting to me as we think about populations within our Muslim community that don't have language around mental health, right? So like if we were to take people of the Middle East, for example, right, where mental health, the idea of mental health or mental illness is highly stigmatized. There's not even a language around mental well-being except for words that are pejorative, right? Like majnoon or, and so honoring the tradition that exists there, using something like a collaborative theory or a narrative therapy, where language is at the center of that theory, becomes very meaningful, because how do you conduct therapy in an area where the language doesn't exist for it? You've got to come in through a different avenue, so that it's congruent with the people. And I think that's also true. I mean, in the Black community, for example, Dr. Derguri, developed post-traumatic slave syndrome, and very relevant to the African American experience, right? And that in and of itself is needed because people need something they recognize. It can't be that one size does not fit all.
Yes. I remember actually reading books about post-traumatic slave syndrome 25, 30 years ago. You know what I'm saying? Dr. Naeem Akbar, books like Breaking the Chains of Psychological Slavery. And, those are some of my most introductory steps toward just self-actualization. So I've always had a great appreciation for like epigenetics and this idea of psychological inheritance. And so it's good to see the Muslim community coming around, in that sense. One observation I had about mental health that always that it really struck me as fascinating was that when we talk about physical health, we tend to talk about physical health in a with gradation, right? We don't. It's not just I'm sick, I'm well. No. It's like I can be functioning, but functioning at 50% or 60%, or I can get around, but right now my hamstring is really bothering me, or I have a bad ankle, or I suffer from some headaches. But none of that kind of compromises my wellness, my physical wellness, in a totalizing way. Like I'm totally unwell. just I have some things that I'm working through, that I'm nursing some injuries, or my walk is a bit labored. But when we talk about mental health, we tend to talk about sanity and insanity, right? There is no, I'm functioning, but there are some issues that are challenging my mental health. And I think like just that small adjustment might help us in destigmatizing this idea of needing help with one's mental health, or struggling with one's mental health, and then being able to seek help.
Right. I mean, one way of verbalizing that, I think, would be, I exist in this system that struggles with justice. Not that we expect necessarily justice within this dunya, right? But like, I exist within this unjust system, and it's affecting my mental well-being, right? Like, maybe I'm socially dislocated. Maybe I'm, not finding a tribe, within my community, because my segment of the community is not valued or something, right? I mean, that's real, and that does cause mental anguish, and would be like pulling a hamstring, because circling back to what we heard about connection. It's important that we all have connection. And that lack of connection is a really serious hamstring pull.
Yeah. I'm currently nursing a pulled hamstring, so I know I have. so that analogy was not something chosen randomly. That's something that I'm thinking, man, I and I enjoyed exercising so much, and I'm unable to exercise, and now the alternative is I have to fast every day just to control my diet. You know what I'm saying? But it's la ilaha illallah.
Well, I mean, look at it this way. Just take, for example, right now in our American Muslim landscape, we have a Black American expression of Islam that has so much in it that has not been well publicized, or like even taken advantage of, in the sense of some of the remedies that have existed. And then we have our immigrants' journey, and then all that they experience, the immigrants that came in the 70s. And now we have, for example, a whole new wave of Afghan refugees, right? And so they're going to start a whole new experience of that immigration process. And so we have waves, right? Where it's like, okay, even if we as a community work through some of our tribulations of connection or lack thereof, there's just another wave that's going to hit us, where people are going to have to go through that same process again. And that's very complex and dynamic, and we don't really talk about that a lot, and how that affects people's mental well-being. Because if we cannot, for example, in that complex system, right, is in America is a clear hierarchy. And if you're dealing with the face of that hierarchy all the time, and you're feeling like every time I get above the water, I get another wave that crashes over me to try to demonstrate to me that I belong further down in the hierarchy, that is going to cause some mental anguish.
No, I totally agree with that. I think, we often underestimate the importance of our attachments and relationships with other people. And that, sometimes we can relive our most traumatic experiences through watching them live similar experiences.
Yeah.
So, myself, going to high school, and I went to a high school that was demographically mixed, some white students, some Black students. Somehow I had advanced placement courses, and I still remember the great stress I felt in all of my classes to outperform my white counterparts. Like I really, and this is in like the mid to late 90s. But I felt, if I submitted a paper and I didn't get the highest grade in the class, I would rip the paper. like I was just very, and my mother would tell me, son, it's okay. It's okay. It's just, it's okay. But something in my environment, many things in my environment were telling me, no, you have to do this. Right. You have to be the best. You have to get the highest grade. Right. You have to represent and alhamdulillah, after embracing Islam and actually reading something that your husband wrote, an article entitled, Islam and Affirmative Action, and talking about embracing your humanity and your worthiness as a product of divine fiat. Like, you're worthy because God made you worthy. It's not that you have to jump through hoops or you have to. Now, of course, there's virtue. There's virtue in knowledge. There's virtue in excellence. But one does not gain their humanity through scholastic or academic excellence. That's something that was given to you. When Allah Ta'ala said, لَقَدْ كَرَّمْنَا بَنِي آدَمَ, truly we have ennobled all of the children of Adam. I was, alhamdulillah, I think that I was able to come to terms with some of what was animating me, in my youth. But now watching my daughter in a similar circumstance, I almost feel like I'm reliving that anguish, that pressure, that tension to overperform, overachieve, be the best. So, even if one, I won't say overcome or triumphs over, but one comes to some healthy understanding of one's past experience, you can still be triggered essentially through watching people you love or people go through similar experiences.
Right.
You know what I'm saying? Yeah.
Absolutely. At the same time, conversely, it can be true as well that it can be healing, right? So, for example, when you have when you're Muslim and you are married and you have a functional marriage, and let's say one or the other spouse didn't have a mother or father at home, in their childhood, but they see that connection with their children and their spouse, whichever they didn't have, right? That can be a healing experience as well, because it's like, oh wow, I see what I missed. I didn't know I didn't know I missed it, but I see that I missed it, and wow, mashallah, that my kids don't have to be without that.
Mashallah, mashallah, mashallah.
So that can happen too, right?
I totally see that too. It's interesting. Something that doesn't, receive enough coverage, in my estimation, is that we've been experiencing in the Black community kind of a renaissance of fatherhood. People speaking very passionately about the importance of fatherhood, and people encouraging each other to take responsibility for your children and to form deep emotional bonds, with them. And I think a lot of that is a reaction to what we didn't experience. Children that were born in the late 1970s, early 1980s, when the prison population was exploding and the war on drugs was in full swing, and the homicide rates were increasing, and government policy was almost predatory in terms of women being denied government aid and food benefits if men were in the home, etc. There was a lot of broken family that kind of occurred as a consequence of personal irresponsibility and the expansion of the welfare state. and mass incarceration, both kind of, both of those happening at the same time. But now I see a lot of that changing. I see a lot of, men stepping up, insisting on being a part of their children's lives. And I think as a community, that has been healing. That there's been something salubrious in that, something healthy, in that. And I think that's been a really, really good thing.
No, absolutely. And I think also as people, as we have more diversity within the role of the therapist, that has allowed for more relevant healing to happen.
Mm-hmm.
So I know, like, the chair of my department, for example, he leads men's groups, and they have lots of healing that happen within those groups. One of my daughters she heads the sister circle at her university.
Mm-hmm.
And so it's a place where Black women come together and talk about exactly these issues that you're talking about. They have sometimes they debate, right? But they also have healing that happens within that environment. And again, that is also relevant culturally, the circle, the idea of tribal, wellness, and while there's been a great effort in the United States to disband any sense of tribal connection, that's, again, you talk about epigenetics, there's still some like stuff that sticks with us, that doesn't disappear. That when we get back in those circles or we get back in those frameworks, it's like, oh, this feels like home.
Right? Yeah, but speaking of which, the other thing that maybe you're in a position to talk about is, I think, a focus on mental health is also a great equalizer. I think sometimes when we think about social issues, there's a tendency to talk about lower class or economically depressed communities while forgetting that you also have a lot of trauma and anguish and mental struggle in the gated community. It's not just what's going on in the, in the hood, so as to speak, but, I think mental health is a place that we see our human fragility. And we see a lot of kind of overlap in our experience as human beings.
Yeah, people don't really get me when I say this, but so there are people that I've met with, let's say, the social location of poverty. And until they come into connection with a world that demonstrates to them how impoverished they are financially, they typically are pretty happy people.
Yeah.
They're connected to other people, and they have, good, sense of community, and there's all these different archetypes in their community, and they're happy with what they have, right? Whereas, conversely, the people who have a lot of wealth, have had some, very serious problems where their wealth sets them apart from others, and there's a disconnection, and there's a lot of isolation, and there is no life raft, if you will, there is, and so they have a lot, I have seen a relationship with the increase of wealth, with the increase of, mental wellness or disease, let's say dis-ease. That's just my experiential, set of knowledge of being a clinician. I've seen that. That's not to say that people who are impoverished don't have other issues that overwhelm them or cause them to have, depressive states and so forth, because we can't deny what the lack of basic resources does to people. But in terms of a sense of self-regard, and like, if it's like people, until somebody has put them in contact with where they fit in that larger picture, it is actually not easily an issue. When they're, brought to a sense of, well, you're less than me because you don't have this or that, and that starts to cause a problem.
Right. Yeah. No, I mean, I was saying it too. I mean, because when we think about, gratitude, right? This spiritual ideal of being grateful, of having gratitude. I think if the focus is only on wealth and material well-being,
stockpiling, like they say in Quran, right?
yeah, exactly. Right? If the focus is only that, sometimes there is much for which we should be thankful that we're overlooking. That's what I'm saying. People who might, and we're not minimizing the significance of their struggle to be to be materially comfortable and to secure basic needs. And we as a society should be focused on delivering to people as much of their basic needs as we possibly can. But even in that materially impoverished state, you might enjoy healthy attachment, you might enjoy community, you might enjoy affirmation, you might enjoy great esteem, you might enjoy positive relationships, and you don't want to look across the tracks thinking everything is greener on that side, when in fact some things might be greener on your side.
That's right.
If a person finds themselves in such a circumstance, right?
Absolutely. Absolutely. Yeah, because when you go up that chain, you see, performative experiences, right? When people are dealing with increased levels of wealth, and then also having to get into different places that they are not used to and they don't know how to navigate, and there's more of a performance happening rather than authenticity.
Yeah.
So then we'll get into a discussion in therapy around the adaptive versus the authentic self.
That's a good one, because I tend to think much of what happens beyond your front door is performative. I think is which doesn't mean that it's irredeemably inauthentic, but it's intentional in a way that is performative. Right? Whether it's our masculinity, our femininity, our professionalism. I mean, when I'm in my house speaking to my wife and my children, my subject doesn't always match my verb. You know what I'm saying? But when I'm in front of a rostrum, my subject usually matches my verb. You know what I'm saying? So there's an intentionality in that I imagine might take a toll on someone.
Yeah.
You know what I'm saying?
And look at that, right? So like our ability to emotionally connect with one another not only affects our like relationship in terms of just being able to have a relationship, right? But it also affects things like sexual intimacy and our ability to take care of others. If we don't have the ability to emotionally connect with others, then we see problems arise in these areas.
Yeah, we had a question from Sister Sabria Shaw. She wanted to know if you'd seen any connection between the decline of mental health and well-being and the increasing secularization of society.
I mean, this is a great question, and it's a very broad question that my particular research hasn't really been in that direction necessarily, but if I were to look at it experientially, because I do treat both Muslims and non-Muslims, there certainly is a significance when someone doesn't have any la, right? Like that but somebody's ilah could be money, right? Like, so like that's not necessarily a positive thing, but like when somebody has no ilah at all, I see definitely there's nothing to grasp onto. There's nothing to hold onto. Now there are healthier ilahs than others, right? And I would consider ours, that we believe in Allah, right, to be the healthiest of the ilahs. But like there could be some unhealthy ilahs that are still healthier than having none, because to have nothing to hold on to, this is where we see when people get into places of high suicidality, there's nothing to grasp onto. There's nothing to hold on to anymore. So even, thinking of the lesser of evils, right? Even some kind of form of ilah is better than none.
Yeah, like almost as if you're saying one must have something that arranges and orders life. There must be something, I've heard it said that the difference between sacrifice and suffering is meaning. That, if someone attaches some meaning to what they're experiencing, there's something that gives their undesirable experience meaning. Whether it's I'm doing it for posterity, I'm doing it for money. This is uncomfortable, but it's going to make me rich one day. Or I'm doing it for various and sundry reasons. That is more manageable than someone that attaches no meaning to what they're experiencing.
So you would like logotherapy, right? Which is meaning-making therapy. It was developed by Viktor Frankl, who was in the camps in Europe, and found through his experience of being in the camps that even if I'm in a box, right, I can find meaning to survive this. And so that turned into a therapy that is about like it's sort of an existential therapy, where you're looking at how to make meaning out of things to get through.
Yeah, no, I mean, I like to think about our collective experience of humanity as being inherently limiting in many ways. I mean, as a human being, you will experience age, maybe. You will certainly experience death. You might experience infirmity. You might experience loneliness. But spirituality and having a metaphysical connection is like a window. We're all in the same room, but through that spiritual meaning, I have a window out of which I can look. Whereas someone that doesn't have that window, I'd imagine their existence, in those confines might be that much more unbearable.
Yeah.
Mashallah. To the point of relationships, because that was kind of the subtitle of our conversation this evening. Within the Muslim community, do you think that couples seeking therapy or individuals seeking therapy about their marriages, is that becoming more popular?
It's hard for me to gauge that, given that I don't know how long people have been seeking therapy within the Muslim community. I do know that, my plate is full with people who are seeking services. And I know that we don't have enough therapists to fill the need that we have within the community. If that is an indication, so there's certainly an interest, I think. One of the issues that arises within our community as we're kind of dipping our toes in the water when it comes to this is understanding, the theoretical backgrounds that people are coming from, understanding what it means to be licensed and not licensed, what it means to. So one of the things I think we could benefit from in our community is becoming better consumers of, what we're going seeking, because I've seen people, so there are careers that are made from like 3 to 6 months of online training, and
Mhm.
people advertising themselves out there to be able to help couples, with that kind of training versus years of training, that is done through, the academy. Um, there's a difference. There's a qualitative difference, but our community is not readily aware of those differences,
Mhm.
nor are they readily aware of like sort of the differences in terms of lens. So, for example, I'm licensed as a marriage and family therapist, and so my view is very systemic in its nature, with an important with a value around social justice, as are a lot of MSWs, right?
Mhm.
But if you are, if your clinical degree is strictly like APA, American Psychological Association, there's not necessarily that focus or interest of the system. It's more on the individual. So
I
that
see.
that can make a big difference, right? Especially
Mhm.
when, from my perspective, in our community, we're looking at the balance of the individual and the collective,
Okay.
and our responsibilities to each. And so
Mhm.
if you don't look at the system, then I find that to be really problematic, from my theoretical orientation.
Mhm.
And so it's really important that, people know what they're entering into.
Yeah, I think, a lot of times I find that sisters are much more open to therapy than they are to guidance that is presented in a strictly religious guise. Because I think often that guidance presented in a strictly religious guise is thought to be partial, it's thought to be biased, it's thought to be less trustworthy. And we're talking about like Muslims of conscience. We're not talking about people that are irreligious, but I think there's this idea that, going to an imam or going to a scholar, um, the a lot of sisters feel as though uh, they won't receive a fair hearing, right? Whereas I think when they sit with the therapist, he or she benefits from a little more open-mindedness from especially I think women that seek marriage or relationship therapy.
Well, our roles are different, right? So to begin with, our roles are different, and that when you go to seek advice or nasiha from a Islamic scholar or an imam, their job is to tell you as a Muslim what's best for you as a Muslim, right? Like,
Hmm.
you know, uh, as a therapist, that's not our job. In fact, our
Hmm.
job is not to advise you at all. Our
Hmm.
job is to listen and to listen more than we speak, and
Hmm.
to help the person see for themselves,
Hmm.
what is congruent with themselves, right? Like, so
Hmm.
um, so that might be a Muslim who's striving to be a better Muslim. That might be a Muslim who is, I'm happy with where I'm at and I just want to maintain where I'm at. That could be somebody who's, I'm barely hanging on to Islam,
Hmm.
right? It's
Hmm.
not a central part of my life. I mean,
Hmm.
or somebody who's like, yeah, my family's Muslim, but I'm not, right? We see all kinds.
Hmm.
So, and our role is not to advise; it is to help them become their best self. But
Hmm.
that's all relevant to the person in front of us. It's not. It's a,
Hmm.
it's a different role.
Yeah, and I think maybe because there is more reciprocity there,
Hmm.
there is more of an exchange. You're listening, right, and helping the person to kind of understand their thoughts, their feelings, you know,
Without
for
judgment as
right
well.
without really offering a prescriptive kind
Right.
of guidance. Maybe you just feel like there's more space for you to be. And the religious setting, by comparison, unless somebody wants that guidance, can feel maybe a little bit stuffy, can feel a little bit. invasive. It can feel maybe a little bit invasive.
And I think at times for women particularly it can feel inaccessible. When I was
Mm-hmm.
growing up, one I found that I had is not that I didn't intentionally set out to do this, but I had more male friends than I did female friends, and it had to do with my interest in education, educating myself. And so when women weren't being given as much access to education, you found that there were more interesting conversations happening in terms of like those, kind of academic conversations happening at more male dominated tables, right?
Mm-hmm.
And if I could have found a group of females who were willing to engage me in that way, I would have been sitting at that table, right?
Mm-hmm.
So I use that to say that if women felt that the knowledge was as accessible, and I think that's something that ALIM is trying to do, right? Like if that were inexistent back when I was younger, I would have been sitting at all female tables, having those conversations. I
Mm-hmm.
think that gets in the way as well, right? We don't necessarily have access, and then even sometimes when we do, um, there have been problems in the community of integrity and of genders, right? Like, so respecting the genders, and when there's been a lack of integrity, there's been some problems around addressing that, right? And so
Mm-hmm.
I think that makes women shy away also from thinking that it's a safe place. And
Mm-hmm.
safety is one of the key components to connection, right? You have to have safety and trust and communication to lead to vulnerability. Vulnerability leads to having that connection. When one of those things are missing, you don't have it.
Mm-hmm. No, agree. We had a question that Zain Bengali posted in the chat about how can individuals or couples who think they may need help find help they can trust?
I mean, this is a great question.
Sure.
Um, uh, I mean, I think this again in a systemic way. We should be thinking about this as communities, funding and promoting the education of someone within our community to become a therapist, right?
Mm-hmm.
To that this is important to us, and therefore we cultivate a person or people that we trust within our community to be, a therapist. Otherwise, that it's kind of like by word of mouth, and we find, I mean, part of our licensing is that we cannot violate, the trust of the people sitting in front of us, right? We can't
Mm-hmm.
speak about their confidential matters. We can't out them or betray them. That's immediate cause to lose our license.
Mm-hmm.
And that's why knowing that sort of piece around licensing is important, right? To know, because if you're dealing with somebody who's not licensed, they're not held to any standard
Mm-hmm.
necessarily.
Mm-hmm. No, very, very important. I think it's a step in the right direction that many Islamic centers and masajid around the country are beginning to employ as a part of the staff of the masjid people that specialize in mental health. So that now, in the same way that you have a religious director, you have people that specialize in mental health services, or at the very least, if someone presents a matter to a member of the religious personnel, there is someone to whom that matter can be escalated, or
Right.
someone that can, be called in to assist, in that way. So I feel like there is some awareness, in our community, and hopefully, we'll be able to answer Zane's question differently in the months and years to come, and we'll have more concerted efforts to make sure that this is a service that we provide in community.
Right. Yeah, and you're absolutely right. Like we take out in Boston, for example, they have a very progressive take on how to treat mental wellness within the community and all types of it. We've piloted a program here in LA that worked really well. But it comes down to, again, like most programming, you have the realities of funding and all of those things. So all that stuff has to be in place. And when we look at places like Philadelphia, this is what, when we go back, circling back to some of the things we were discussing earlier, some of these things have been in place for decades. Yeah. So, I recently interviewed Brother Abdul Karim from Philadelphia, who they had created a whole substance abuse program like 3 decades ago for Muslims to be congruent with being a Muslim. And it's been very effective and has chapters all along the Eastern Seaboard. But, outside of the Black community, let's say it's not as well known, but it could be utilized by all Muslims. It's, necessary and needed.
Yeah, we have a similar group in Chicago. I believe the group is known as Millati Islam. Like my path is Islam. Brother Hussein Abdul Aziz, Sister Habiba Collins, they've been doing this work for decades, but you probably won't see them speaking at any conferences. You probably won't see their interviews with them included in the most recent scholarly tomes about Muslims and addiction counseling. So sometimes it's not that these services haven't been a part of our communal experience. It's just that the people that are doing the work aren't really given a platform. They're not profiled. They're not featured. We don't seek them out so that we can benefit from their expertise. But they often are there.
Right. And like for example, one issue that has come up as been a hot issue during COVID is domestic violence, right? So that we saw an increase in general in domestic violence across communities, both Muslim and non-Muslim. In Philadelphia, they had a masjid that at one point, and I don't know about the Islamic law piece of this, but where they had a list on the community board saying, these brothers have been accused of this or found to have done this, and so if you're interested in them, be aware. They weren't, I don't think they were stopping people, but from joining in relationship, but they were like, be aware. And that is a community trying to have its own health. And that existed already. We just need to tap into it. We don't have to recreate the wheel.
Yeah, that's a tough situation, because I'm sure the goal is protection of the community, and also I think to remind our sisters of their value, that this isn't not only is this something that we don't condone, this is actually something that we absolutely detest and find completely unacceptable. At the same time, one doesn't want to scandalize, either, and you want to leave room for people to repent, and you don't want to, I don't. It's very difficult. I mean, I'm in this regard. I'm reminded of the hadith of the Prophet ﷺ, when a woman was considering 2 suitors, and the Prophet mentioned that one of them wasn't a gentleman. He was a heavy-handed person. And this, of course, was not considered backbiting or scandalizing, but it was considered, sincere advice, to that woman. So there is certainly some precedent there. However, in our society, I think things like this can take on a life of their own. You know what I'm saying? So it's a very difficult set of priorities to balance.
And also, I mean, I want to circle back to something you mentioned about the sisters seeking therapy. So I have actually seen a lot of men seeking therapy as well, and that is something that they're daring greatly, if I can say that, to do that because they have been taught, not to express emotion. They've been taught that it's not acceptable. And in the same way, in this, what we were just talking about, DV happens to men too.
Mm-hmm.
And there's even more shame, I would say, in terms of externalizing that and saying, hey, this is happening to me. Then we accept it coming from women, but we don't accept giving space to it for men. We don't accept giving space to men who've had sexual trauma. We have women who have sexually traumatized our men that we don't give space for that, and that's very problematic.
Agreed. Agreed. I think a lot of people don't realize that the vulnerability that many women take for granted they can express is sometimes years in the making for men. Men need added assurances of comfort and confidentiality to express much of what is troubling them. Right? This is very, very important. Very, and many of us have been taught, I think, as men, that to express those emotions is less than ideal. It's something that decreases one's valor or decreases one's masculinity, right? To speak about those things that create stress or anguish or tension or discomfort or sadness or disappointment in one's life. And I think that there is a great deal of precedent in Islam for the Prophet ﷺ discussing these things with people and giving people license to discuss those things.
Right. That was so powerful to me what you just said there, and I had this image coming to my mind of Louis Armstrong, blowing his horn, because that was an acceptable expression of his emotion.
And mashallah, beautiful. That's beautiful.
Right, and then but even he got to a point where doing that was no longer the way he could do it anymore. Right, he got to that point where he's like, I can't play this stuff anymore, or my soul is going to pull the plug, right?
That was Miles Davis, but
Miles Davis, sorry.
Right, of course.
So that people can get to that point where, okay, so I don't have it, I can't express it this way, then let me go this way. So we'll see it in artistic form.
Right. No, that's a very profound. My grandfather was a big jazz fan, and I lived with my grandfather for about 3 or 4 years in my childhood, and he would play jazz and tell me all the stories of jazz. So I probably know much more about jazz music than a person my age should. Right. And my grandfather and I, we had some good times and we had some bad times, and the music was very much a part of the good times and the bad times. I can remember getting off the bus and hearing the jazz from like a block away, and if I heard the music and he was playing it really loudly, I knew he had been drinking, because he liked to play his music, it's like the music was almost like the preview of, I don't know what I'm gonna see when I get there, right? On the other hand, he loved to talk about the music, talk about the culture of the music. And I remember him saying that you had some players that were known for their virtuosity. So he would say like Dizzy Gillespie and Charlie Parker, Bird, they would just be squeezing all of these notes and it was just, and he said Miles Davis wanted to play like that, but couldn't really play like that. So he just became a very sensitive player. He would, his playing, rather than just overpowering you with virtuosity, his playing was very intentionally a window into his soul. And at that time, that was
I feel that too when I listen to Miles Davis, and I caution myself because I don't want to get lost in the music.
Right.
So, but yeah, you can feel that.
Yeah,
Yeah.
it's very, very much a sensitive player of, and of course, that that sensitivity, that vulnerability in his art, is then masked by a very harsh kind of personality. His personality is very abrasive. You
Mm.
know, Miles Davis' personality was intentionally very abrasive, very, very hard to get along with. My grandfather would say because his music was so sensitive.
Well, because he felt safe to express himself there.
You know, so I think with men it's often about, you know, creating a space, creating outlets, you know, where those parts of ourselves can be seen, where we care to allow them to be seen, you know.
Yeah, Resman Menachem, I don't know if you're familiar with his work, My
Mhm.
Grandmother's Hands. It's about the traumatogenic effects, in the Black community, and mental well-being. And one of the things that he talks about is just how to be a Black person in America is draining, like every day. Like it
Mhm.
just, you know,
Mhm.
your sucks your you know
You cheat, yo Roy.
yeah, and so like you have to give your body rest.
Mm.
But when we think about people, like you're describing, Miles Davis, Charlie Parker, all those people in that time, where was there any rest for them at all?
Yeah, no,
To say that there's rest even now, but like at
mm,
least we're talking about it.
mm. No, yeah, I think one thing I've heard some mental health professionals talk about, for all of us really, is just this state of hypervigilance.
Hmm.
That you're in a state of hypervigilance. You're trying to protect your integrity professionally. That some people enter their jobs, women, people of color, and it's almost like every day is an audition, you know, and if they make some, you know, solecism, some grammatical mistake, it's like their entire credibility is blown. It's like when you think about what it means to live under that kind of pressure, um, it's something that I imagine, you know, must be maddening, really.
Well, and that hypervigilance, right, is a symptom of, a less than secure attachment. So
Mm,
hypervigilance looks like, or is included in both an anxious attachment and an
mm,
avoidant attachment, or a fearful attachment has parts
mm,
of both anxious and avoidant.
mm.
Um, and these dynamics can cause relational issues.
No, agree, agree. You know, this has been, mashallah, this has been a very quick hour and a half, you know, but as is the case when you're talking with people that you respect and admire and esteem and that you consider family, the time goes just like that, you know, mashallah. But we do have a few more moments, and I want to make sure any of your projects, any of your work, anything maybe that you'd like to offer as general advice to you know our listeners here at ALIM. I want to make sure you have, you know, sufficient time to do that.
Wow. Well, thank you. To be honest with you, I am going to enter into one of those moments of, putting on my own oxygen mask before helping others, because, I believe in sort of modeling what we are asking others to do. And
Mm,
I don't know, you maybe are not aware that my mother-in-law has started having cognitive decline. And
mm,
so I'm going to be taking the next few months. I'll still be doing my professor duties,
mhm,
and I will be seeing a few people in my private practice. But I'm going to
mm.
be taking some time to just spend with my mother-in-law.
May Allah strengthen her. And
She,
mashallah, I've had the privilege of spending some time in her company. Um, a
she's about
very
to be 90 years old, and
mashallah, very graceful,
old week.
a very graceful woman, but definitely a woman of presence. You know, I felt very much the gravitas of her presence when I was in her company. and I also could feel her grace, and I pray that that process yields great benefit for you and great benefit for her as well.
No,
Inshallah.
alhamdulillah. I mean, like, but it's important that we take that time for that relationship, right?
Mm,
I want to be there as much as possible for her. Um, and so the only way I can find to do that is to sort of cut back a little bit
mm,
for a few months, and then
mm.
inshallah we'll see where things are. Um, but when Allah, decides that it's time for us to experience these tribulations, it's time.
Yeah, no, indeed. My wife's grandmother just turned 100.
MashaAllah.
In July, and we visited her. She lives in New York City, and still does crossword puzzles, and remembers my name when she sees me. And one thing that 'cause she's the oldest person I know. Whenever I think about people like that, it's like they embody a different way of being in the world,
Hmm.
right? They very much embody almost like a different way of being human. That I can see that as people like that, go, as people like that depart us, you know, uh, unless we have strong traditions through which we've really tried to retain the best of what they represented, something is irretrievably lost. Like like people like that don't exist anymore. Like
Right.
whenever, sometimes when she speaks, and she's a devout Christian woman,
Hmm.
um, and I'm like, wow, people like this don't exist anymore.
Yeah, that's my mother-in-law, right? She's very patient. She has a lot of faith. It's,
Mhm.
and it's here's the thing, right? There's a couple different types of dementia. Um,
Mhm.
Alzheimer's, when people have Alzheimer's, they don't know what's happening to them. So it's really the people around them that suffer because they see the person leaving, but they don't know, the person themselves doesn't know what's happening
Mhm.
typically.
Mhm.
But though the rest of us who don't get Alzheimer's eventually at some point will get vascular dementia. And
Mhm.
vascular dementia, you do know when it's happening to you. And so
Mhm.
that's what kind of dementia she has. And it's like, uh, she knows, right? She knows that she's not able to do some things that she was able to do. And it's a hard thing to, confront.
Mhm.
And yeah,
Well,
so
be sure to give her our best and to tell her that we're praying for her, and you know, um, wishing and hoping and trying to will, the very best, inshallah. And if we can be of service, in any way as a community, be sure to lean on us. I think sometimes when we're dealing with those kinds of, internal, familial issues, we forget that we're still a part of a greater collective. And the sum is greater than what is it, the whole is greater than the sum of its parts. So consider me individually, at your service, and also at your husband's service, if we can do anything, inshallah.
no, I appreciate that. Jazakallahu khairan. Just leave you with this piece about relationships, right?
Mm,
Um, when my mother-in-law came to live with me, we had a relationship, like for almost 30 years.
mhm,
Um, but when she came to live with me about 5 years ago, our relationship got stronger, and I really got to know aspects of her that I had not known before. Um, and even in her 80s, right? When she came to live with me, she's in her 80s. Um, she unfortunately was someone whose mother passed away when she was a child, like a small child.
mm,
By my serving her or being able to serve her and be of service to her, I was able to give her sort of that maternal piece that
mm,
was not there. And so
mm.
even in her 80s, there was a sense of healing that occurred
Allahu Akbar. Allahu Akbar.
simultaneously for me. She exposed me to things that I didn't have access to and was able to experience, with her as well. That was very healing, or at least expansive for me. My understanding of people, and so it's really something when you see people start to decline, you take care of them, like washing their bodies, taking care, and you see the life markings that are behind on their bodies, the stuff that people don't see normally, but you see it, and it's very it's an amazing experience. And I think that to the extent that we can encourage our generation to keep intact those generational relationships, we need to strongly encourage it, because there's so much to learn through that whole life process, right? That's what I would hope for our community, and want to say that keep those relationships alive as much as you can, and be a part of them. Take them in, and
MashaAllah, MashaAllah. وختامه مسك, and it's sealed with nectar, MashaAllah. It's sealed with musk. Thank you for an illuminating evening of conversation. Hopefully we'll get a chance to do this again soon, inshallah.
How do you spell leg?
L-E-G. L-E-G. G. بسم الله. بسم الله الرحمن الرحيم. والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. سبحان الله وبحمده سبحانك اللهم وبحمدك ونشهد أن لا إله إلا أنت ونستغفرك ونتوب إليك. آمين يا رب العالمين. السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
Bismillahirrahmanirrahim. This is Sabria. Thank you guys so much for joining. That was a beautiful, beautiful discussion with Dr. Heather and with Ustadh Ubaydullah. We just want to leave you with a few announcements. We wanted to mention that, alhamdulillah, Adam was able to be the recipient of the Hibri Foundation Award. We were honored to be rewarded a $25,000 grant and be recognized as a national nonprofit training current and future leaders of America. The award funded new initiatives this past year, including Adam's expanded curriculum and leadership programs. We also want to let you know that we will be holding our annual summer program this year at Benedictine University, inshallah. The seats are filling up quickly, so if you would like to register, we encourage you to go to alimprogram.com. Inshallah, we are putting in the link in the chat, alimprogram.com/summer-program. Sign up as soon as you can, because the seats will fill up very quickly, alhamdulillah. We just want to leave you with some quick facts about Adam this year that we've been able to do. We've expanded the team to fulfill programming. We've had monthly blogs and virtual live events hosted by Ustadh Ubaydullah with different community leaders, as you just saw. The 22nd annual Adam Summer Program was successfully held in person this year. We had students over from 16 states and even an international student. We're going to have some hybrid spring programs, inshallah, on the aspects of the Prophet. We are going to have an upcoming winter's virtual series on the life of Malcolm and lessons from his legacy. And we will be doing a virtual session this spring, and more information will come soon, inshallah. Please do keep us and the team in your du'as, and thank you for joining. Assalamu alaikum.